community leaders, with advocacies, with advocates who will allow us to take the understanding to far-reaching lands. Since its inception, Rabta has been focused on a variety of key subjects which are of a lot of value to the people of Pakistan, but our cornerstones have been about healthcare, about education, economy, and the future, which includes, of course, youth issues, technology issues, and the dream and the vision of digital Pakistan. Today we gather here, and of course we are very grateful to the Honourable Federal Minister for Health, Syed Mustapha Kamal Sahab, for his presence. Ladies and gentlemen, this definitely deserves a round of applause. We've known Mustapha Sahab for being a true committed change leader, be it his tenure as the mayor of Karachi, which we Karachiites remember as one of the best times for the city, where we could actually think about infrastructure not in a very typical way. And today when I see him working towards a public infrastructure for health, his efforts are commendable. Be it polio or the fight against cervical cancer, I think he's truly led it with being in the forefront. I was especially touched as a Pakistani woman when he publicly administered the HPV vaccine for his own daughter to take away the propaganda, the misconception. I think that truly requires a lot of bravery and courage. Ladies and gentlemen, big round of applause. We also have with us, of course, this is the first time Rabta is partnering with a credible world-class institution, that is the Marouf International Hospital. I've known the dynamic CEO, Harun Nasir, in my personal capacity. He's been a part of a variety of initiatives. But today, as we partner, we are truly getting to the heart of the affairs. Never beat and heartbeat. And as a media personality focused on public health care, it is very, very agonizing and heartbreaking, pun intended, that we know that the cardiac diseases and the cardiac conditions in Pakistan are on the rise. There are multiple lifestyle issues that contribute to it. So it was really important to bring our focus to cardiac care. And that is our intention today. You will hear from some of the best practitioners. And today I'm also very relieved that we have the wonderful Rubina from the Marouf International Hospitals taking the reins of it. So without any further ado, I'll hand it over back to them. But once again, on behalf of Serena and on behalf of Rabta, I would like to welcome all the distinguished audience members to our event today. Thank you.
Thank you, Sidra, for your kind words. Ladies and gentlemen, I am very pleased to now invite Dr. Mir Wahid, the Medical Director and Head of the Accidents and Emergency Department at Marouf International Hospital. Please, in shaping MIH into a system of quality healthcare and service. Sir, please.
Bismillah ar-Rahman ar-Rahim. Honorable Federal Health Minister, His Excellency Syed Mustapha Kamal Sahab, respected Mr. Aziz Bolani Sahab, CEO, Serena Hotels, distinguished foreign dignitaries, panelists, healthcare professionals, members of the media, ladies and gentlemen, Assalamu alaikum, and a very good morning, but afternoon. It's a great honor and privilege to welcome you all to this special gathering on World Heart Day 2025. Today we come together with a shared mission to raise awareness about heart health, prevention, and care. Cardiovascular disease remains the leading cause of death globally. Around 20 million lives per annum are lost due to cardiac disease. In Pakistan alone, nearly 1 in 4 deaths are linked to heart disease. As Dr. Wahid mentioned, it might be through diabetes, it might be due to the risk factors that he mentioned. These numbers, for all of us that are here, we need to realize that these numbers are very alarming, but they're not unchangeable. With education, early detection, and collective action, we can save countless lives and rewrite the story. I would like to express my heartfelt gratitude to our chief guest, the Honorable Federal Health Minister, Mustapha Kamal Sahab, for his unwavering commitment to improving public health in Pakistan. Your presence here today reflects the government's dedication to building a healthier, stronger nation. I had the honor of meeting Mustapha about a couple of weeks ago, and I felt very proud to have someone in that position who knows about what the plan is, how we're going to execute it, and the strategy is laid out. We talked about research, which is one of the key factors that Pakistan has an opportunity to bring in that investment that we're looking for, medical research. We talked about developing clinical pathways. We talked about the primary healthcare, secondary healthcare, and all of these aspects. So thank you, Mustafa Bhai, for giving us that time. A special thanks to Mr. Aziz Bolani Sahab and the Serena Hotels team. You generously hosted this event and provided hospitality services. This is a powerful example of how the corporate sector and healthcare institutions can work together to make a real difference in society. I believe this is just the beginning. We're initiating this awareness talk, but there's a lot more that can be done, and we may talk about it in the future. We're also honored to have foreign dignitaries with us today. Your participation reminds us that the heart health is a global challenge. It's not just in Pakistan, it's everywhere around the world. And it will take global cooperation to overcome it. World Heart Day is more than a date on the calendar. It is a call to action. Every heartbeat matters, and every life saved is a collective victory. At Maarof International Hospital, our vision is to provide world-class facilities using the latest technology and expertise. Promote early detection. This is the key. We were talking to the senior management of Serena earlier. We're talking to fellow guests coming in. Screening is absolutely crucial. Feeling those symptoms and ignoring them is not the way forward. We need to screen ourselves in order for us to get clarity and take the corrective action. Raise public awareness through community outreach programs, especially amongst underserved populations. This event is a vital part of our community support program. As Bolani Sahab, we as a hospital have a community outreach program where we reach out to communities, be it on women health, men health, hygiene, gynae-related aspects. We have medical camps, not just around these F sectors, but going outside to villages within our reach, which is about 2.5 hours. And sir, wherever you require our help, we spoke to the Chief Commissioner, dengue and all of these, we can help in terms of, testing them. We can help in terms of making sure that the awareness is there. This program, we would like to, extend our hands to Serena as well as the ministry, that we're here wherever Maarof or healthcare is required. We shall be there to facilitate. In closing, I want to thank all our distinguished panelists, our dedicated doctors. A salute to all my doctors and my team, and everyone who has worked tirelessly to make this event possible. Let today serve as a reminder that together the government, the healthcare providers, the corporate partners, international friends, and citizens, we can fight cardiovascular disease and build a future where every heartbeat is stronger. Thank you once again for joining us and standing with us in this noble mission. Pakistan Zindabad.
Consultant in emergency medicine, one of the few people in Pakistan who are trained in emergency medicines. Sir, please go.
Can we start the presentation, please? Honorable Sayyid Mustafa Kamal, Federal Minister for Health Services, Mr. Aziz Bolani, CEO, Mr. Harun Nasir, CEO Maarof International Hospital, Excellencies, ladies and gentlemen, on behalf of Maarof International Hospital, I would like to welcome you today all to this event to celebrate World Heart Day. My talk will be a short and crisp one, and it will basically revolve around the reason why we have all been here today. So the World Heart Day is actually envisaged by the World Heart Federation about 20 years ago, when they realized that cardiovascular disease is the #1 killer in the world, And this is one of the few diseases where prevention can actually make a lot of difference. So that was the reason that World Heart Federation has designated September 29 every year to be celebrated as World Heart Day. And every year, actually, they bring out a new theme, which is there to actually enlighten the communities, bring out that thing from the communities that they have to participate within their communities, take this message out that this is a preventable disease. And that's the reason that this year they have actually given the theme quality sleep, help miss a beat. So this year, don't miss a beat means what? It means that every heartbeat matters, be it an adult, be it a child, or anyone with low socioeconomic background. Don't ignore warning signs, which I'm going to talk about it shortly. Ensure access to timely care and promote prevention and awareness. And that's what we are here gathered today. So why is it important and why the heart health matters? Nearly 20 million people die each year from cerebrovascular diseases, which include cardiac disease and stroke. So don't miss a beat. This year is a global call for action. And what are the actions we need? So first of all, we need to know actually what are the warning signs which we pay heed to. So first of all, if we notice a chest pain or discomfort, if we feel shortness of breath, dizziness or fainting, irregular heartbeat, swelling in the legs or feet, these are the warning signs and we should seek immediate help. What are the risk factors? So many of us will feel that diabetes is a major risk factor in Pakistan. You will be surprised to know that Pakistan has the highest number of diabetics in the world. High blood pressure, which goes hand in glove with the diabetes. Somebody develops diabetes, he's bound to develop high blood pressure. Similarly, smoking and tobacco use, unhealthy diet, lack of physical activity, stress and poor sleep. We have not been paying attention to this aspect of our lives. We work all day, sometimes we don't get enough sleep, but stress and sleep are two very important factors, and I'll talk shortly about them, that how they actually double the risk of heart disease if you don't get proper sleep and if you have stress in your lives. So what are the preventions actually for which we have been gathered here today? So we all have to have a balanced diet, which should be low salt, less sugar, more fruits and veggies. We have to exercise regularly. We have to manage stress and sleep well. Minimum of 8 hours of sleep is essential for 24 hours. We should avoid smoking and limit alcohol and get regular health checkups. One of the major issues in cardiac disease is the equality and access to health care. 75% of the cardiovascular diseases occur in low-income socioeconomic countries, and unfortunately Pakistan is one of them. So why is that? It's basically because lack of awareness, lack of preventive strategies, and then when something happens, we don't have actually resources to treat those patients. As I said, psychological stress can double the risk of heart attack. Exercise, meditation, and getting enough quality sleep helps to lower stress levels. So today, the take-home message from us is that we need to know our risks. We support community initiatives like the one we are doing today. We spread awareness, and we don't miss a beat, which is the theme for this year's Heart Day. We have talked about prevention, but if that prevention fails and it comes to a point where somebody needs help, alhamdulillah, we are proud to state that Maarof Cardiovascular Center is a state-of-the-art cardiovascular center, and we provide pediatric and adult cardiac surgeries. We are only private hospital in the north of Pakistan where we provide non-surgical cardiac intervention for our pediatric population. And we are proud partners with the Chief Minister Punjab initiative for cardiac surgeries. And we have actually done so far about 100 cardiac surgeries since we started about 8 months ago. So we are thankful to the Chief Minister of Punjab and the federal government, because that's what access to health is mean. These are the patients who have been waiting for years and years for their surgeries, and now they are getting everything done and at the timely manner. So at the end, I would just thank you all once again, and we will have a short expert panel discussion where we will elaborate on all these topics which I just mentioned. So I thank you all once again. Thank you.
Regulations and coordination. Despite his demanding schedules, overseeing national campaigns like Ms. Sidra mentioned, the polio eradication, telemedicines and health system services, and ensuring quality healthcare reaches to everyone, especially the underserved communities. He has been committed by himself and taking us on board as well. Thank you very much, sir. Please come to the dais.
Bismillahirrahmanirrahim. رب اشرح لي صدري ويسر لي امري واحلل عقدة من لساني يفقهوا قولي. Sallallahu alaihi wasallam. Distinguished guest, panelist, Harun Saab, Aziz Saab, Sidra, to everybody, all the doctors and panelists and all the specialists and cardiac specialists, people from media, to everybody, assalamu alaikum ji. Well, no, I'm not in a hurry. I have been scheduled for this time and I'm here. Just a couple of minutes back, it's such a coincidence today that there was a program of PPMA, Pharmaceutical Industries Organization. It started 9 a.m. in the morning. So I was within the vicinity. 2 hours we spent there, and now with you, well, ladies and gentlemen, doctors and professors, and to everyone, this healthcare system and healthcare is a long-lasting issue and subject till the last day of this world, I would say. Till the day of judgment, till the time the human beings are there, they will be needing care and medicine and doctors and so on and so forth. So it's a long-term subject. Well, in Pakistan, the world which has got away from many diseases, many problems, but we are in number one today, unfortunately, in all those areas. The issue, the problem of our, like the presentation was given by the CEO, Saab, that the life, all the categories which makes you a heart patient, we excel in all those categories. We excel in everything. So that's to me. I was just whenever there was a talk that I know something about this health ministry and health care system of Pakistan. It really reminds me of my initial days of this ministry. I was just talking to Aziz Saab that when 4 months I couldn't speak a word because I was just listening, because this was a new subject to me, to be very honest. I'm not a doctor, neither have I done this thing before, this sort of job. And even in Islamabad, I'd been the MPA, the minister in 2003 of IT, and then the mayor of Karachi, then senator, then this job. But this job is entirely was a new subject for me, and had no idea before. So in 4 months, I just listened to the people, tried to understand. And I've understood one thing. When we talk about the healthcare system of Pakistan, I don't believe in this, because this is not an healthcare system. Healthcare talks about allowing people not to fall sick. Healthcare is all about prevention. Healthcare starts from out of hospitals. Our focus, the government focus, and everyone's focus is just on hospitals, and not only those. Even there are segmentation of those hospitals, the tertiary care hospitals. So they think that everything happens within the walls of those hospitals. No, the healthcare starts right from the birth of the child, then the clean drinking water, then the environment, then the mindset. People, world, nations have got rid of many things, and just because they listen to those authorities, they follow the instructions, they follow the experts' views, and that is like they go for vaccination, they go for other things. Here you start something and you come to know that what sort of, we don't need any enemies from outside. We ourselves are the bigger enemies of ourselves in many things. So when it comes to healthcare, to me healthcare is all about not allowing people to fall sick. So right now what the system we have in Pakistan, that's not the healthcare, it's a sick care system of Pakistan. We are waiting for the people to come into the hospital and then our work will start. If that remains the case, that we don't put effort on our society, on our environment, on our people outside the hospitals, in many issues which prevents people to fall sick, then no matter if you build hospitals on every corner of the street, those hospitals will be obsolete on a very first day, because our whole environment, whole society, everything has become an industry, a factory of producing more and more sick people. So when it comes to healthcare, we have to put things right in a manner where we talk about prevention, we talk about the lifestyle medicine, we talk about society's changes of their attitude, their mindset, and everything. So this topic today, don't miss a heartbeat, and all which has been, whatever has been spoken, the guidelines have been given. I'm so excited to be present in this gathering, to witness this, and this is the way forward. I would say this is the way forward. We must talk more and more and all the time about prevention, about changing people's mind, changing people's attitude, and enabling a person in Pakistan to take care of themselves, take care of himself, take care of herself. Because if everybody today, there's a norm in Pakistan that governments are being blamed for not providing the proper healthcare facilities in the government organization. Yes, fair enough. There must be many deficiencies, but how about the private sector? Are they standing? If somebody goes to the private sector, are they waiting for the people to just come and just throwing flour on them? No, that's not the case. Every day I receive call for the private sector hospital to please call someone to reduce the waiting time for them, call someone to reduce the operations time for them, call someone to reduce the investigation time for them. Because everywhere it's flooded. Our hospitals are flooded. So the crux of the whole story is we have to go on prevention. That is what the health. We have to enable. We have to educate people not to fall sick, for God's sake, and that starts right from the birth rate of this country. 3.6 is a fertility rate, highest in this region. We are the 7th largest country in the world today. After just 5 years down the line, we will be the 6th largest country in the world. We add every year more than El Salvador's population. 6.109 is El Salvador's population. We add 6.19 million. El Salvador's a common people don't understand much, doesn't know much about the El Salvador. So I use the example of New Zealand, 5.3 million. So every single year we are adding one New Zealand in our country, despite all this stress kind of resources we have. So, and yet we have problem in taking the vaccination of polio. They said the fertility rate will go down, the child will. بابا کدھر فرٹیلیٹی ریٹ جا رہی نیچے یار, گاڈ سے. یہ تو لگتا ہے الٹا اثر کر رہی ہے ہم پر. سو دس از اینڈ دیٹ از اینڈ دین when we have the society, آپ ڈاکٹر حضرات, you always say and you normally say, and there's a talk of every doctor, the 68% diseases are the water-borne diseases. اب آپ, if you have the clean drinking water in the country, the 68% burden will be reduced from the hospital. So let's give a glance of the clean drinking water here in Pakistan. Right at the top of the country, whatever the first neighborhood and or the house there is in Pakistan, in Gilgit area or on a mountain, when they flush their sewage, into the system, the sewage doesn't get recycled, treated, and it goes raw into someone's drinking water to the next neighborhood. And then someone on their next neighborhood, when they discharge their sewage, that goes to the another neighborhood. So from all the way from Gilgit-Baltistan till Karachi, the whole country is drinking each other's sewage. Yes? When we issue the housing societies regulation, the officer, before giving that permission to that housing neighborhood, they see the checklist is, well, whether they will build the developer will build the roads or not, will build the parks or not, will build the hospitals or not, will provide the water or not. There's nowhere written in the paper whether they will treat their sewage or not. That's not there. So in our national chip of the brain, as a nation, we do not even consider treating that sewage and throwing it out. Yet we call the 68% diseases or the waterborne diseases. So, I mean, when I was talking to this thing, it's been 6 months I've been talking this. When I said it first time, people were like, oh, this is also an issue. So either the doctors should not be telling me the 68% diseases are the waterborne diseases. Or if that is the case, if that is true, so then treat your water and then drink. Treat your water. So what I mean by saying all the, and I can go on and on. What I mean by this country, this nation, our society is a factory to produce more and more sick people. More and more sick people. So we, right now, this is not a healthcare system. It's a sick care system of Pakistan. Yes, our aim and objective is to convert the sick care system of Pakistan to a healthcare system of Pakistan, where we allow, people not to fall sick. We enable people not to fall sick, and this can't be done alone by the government itself. Definitely, with the private sector, with the professor, with the doctor, the people from the same. From this medical fraternity, we have to work together. Many things need to be done by us, by the government, where you won't find us lagging behind. There's no impediments, no barriers to get in touch, talk to us, and make your things understand to us, and we are working. We are reacting on that. So there's no prerequisite from this government that we can do this and we can't do that. We can do everything, whatever is required for the society, for the industry, for the doctors, for the people of Pakistan, in order to have the best healthcare facilities in Pakistan. We are ready to do that, and we'll do that. And we'll if not directly, then we will enable some investigation time for that. These doctors and professor and Harun Sahab, and to everyone, thank you very much for giving me this opportunity. I'm honored, I'm privileged to share my thoughts, and seeing you, and you allowed me to express my feeling. I'm so honored, and thank you so much, and I wish a success to this conference. Thank you very much.
Excellency, may I request you to please stay here for the moment, and I would also request Serena Hotels Dr. Mir Abdul Wahid to please come to the dais.
Panel start karte hain. Shidra?
Thank you very much, sir. That's a great honor if you would join us. Okay. Sure. I would request the Honorable CEOs of Serena and Marouf Hotels and the Medical Director to please present the Appreciation Shield to the Honorable Chief Guest, Syed Mustapha Kamal, Federal Minister for National Health, Regulations and Services. Shall we continue with the shields distribution ceremony? Thank you very much, sir, for honoring us with your presence. Thank you. Thank you very much, sir. Thank you very much. I would like to invite the honorable panelists because we have appreciation shields for them, and we are very glad that the honorable chief guest has allowed us to go ahead with the shield distribution first. I would request first of all Ms. Ms. Nayar Ali to come to the stage. Ms. Nayar Ali is the Secretary, National Press Club, Islamabad, and she has recently been deputed as the Chief Bureau of News 365. A big round of applause for Ms. Nayar Ali. Thank you very much, Ms. Nayar Ali, for joining us. I would now request Dr. Fahad Khalid, Consultant, Interventional Cardiologist, Marouf International Hospital, to please come and receive your appreciation shield from the Honorable Chief Guest and our CEOs. I would also request Mr. Shahzad Alam, National Professional Officer, Non-Communicable Diseases at the World Health Organization. Please come to the stage and receive your appreciation shield from the Chief Guest. Thank you very much, Shahzad Sahab, for joining us today. I would request now Dr. Sir, please turn around. I would now request Dr. Rashid Ali Khan, Head of Marouf Psychiatry Department, a UK-trained consultant psychiatrist. Please come to the stage and receive your appreciation shield from the CEOs of Marouf International Hospital, Serena Hotels, and the Honorable Chief Guest, Syed Mustapha Kamal. We have an appreciation shield for Serena Hotels. I would also request Dr. Usman Aftab. Dr. Usman Aftab, please come to the stage. Ladies and gentlemen, Dr. Usman Aftab is a consultant gastroenterologist, Head of Department of Medicines, Marouf International Hospital. One of my father's favorite doctor as well, because he treated him when he was on his business trip. A big round of applause for Dr. Usman Aftab. We also have Dr. Marouf, cardiac surgeon. Please, Dr. Marouf, come to the stage to receive your appreciation shield. Ladies and gentlemen, please put your hands together for Dr. Marouf. The next shield is for Serena Hotels. Mr. Aziz Bulani, Hilal Imtiaz, CEO of Serena Hotels, is receiving his appreciation shield from the Honorable Federal Health Minister and CEO of Marouf International Hospital. I would also like to request Ms. Sidra Iqbal to receive her appreciation shield